The Spanish squat is an unusual exercise to work your quads more and to help with knee pain. I call it the anti-knees over toe squat exercise because it's actually trying to keep your knees as far back behind your toes as possible to minimize strain on the knee. Now this goes against everything that Ben Patrick talks about in his knees over toe program. Watch this video and I'll explain why and how it can help you in your recovery. We know if we're having difficulty with squatting or pain with things like stairs, that eventually we need to train in that range of motion with that knee starting to move forward toward or even over the toes if we want to be able to do that activity without difficulty. Any good rehab program will have different levels of regression as opposed to progression to get you to be able to do the activity and load that difficult range of motion. Ben's program is great, but what if you have someone that can't even tolerate the maximum level of regression, where they continue to have pain regardless of the step height that you use for that knee over toe squat? Well, that's where something like this Spanish squat might come in, and I have no idea why it's called a Spanish squat. But what you're doing is you're giving your body some help by bringing the tibia forward and introducing a little bit of gapping in the knee joint with a really heavy band. Now they've done some studies on this exercise, and in the studies that have been done, actually the only study I've seen done on the Spanish squat, they used a rigid strap rather than a resistance band. I'm using the heaviest band that I have, which goes up to about 80 pounds. And from there, I'm just trying to squat so that my shins stay perpendicular to the ground or straight up and down. Now that's not enough help, so I need to back up a little bit so that I can maintain that position. That's taking all of the pressure off of the front of my knees, and I can get a significant quad workout without irritating my tendons or my kneecap joints. Why would you do this, you ask? Well, it's going to allow you to load those quads, build the strength as you're preparing to be able to do more difficult activities. So while you're doing, say, a program like ATG, trying to get your knees over toe, but you can't really get a lot of quad strengthening when you're in those regressed stages, you can do this type of a Spanish squat and really load your quads without irritating the tissues of your knee. In that study, they compared the Spanish squat to both a traditional squat and I don't remember squat. Oh, that's right. To both a traditional squat and a wall squat, where you're sliding up and down the wall with the exercise ball behind your back. The results of that study found significantly more muscle contraction in the outside and front of the quad muscle, or the vastus lateralis and the rectus femoris. Also found increased activity in the vastus medialis and all the hamstring muscles, just not as significant as the front and side of the quad. You might not know this, but that like button is struggling with knee pain today. Give it a click to help it recover. One thing we see commonly in our physical therapy offices is that the knee loses its ability to glide in all the directions it needs for full bending and straightening. So another thing this Spanish squat is doing is it's helping to glide that knee forward, opening up a little bit more freedom, kind of like it's prying the knee open when you're going into that bend, which will then give it a little bit more freedom to move and less pain. Another thing that's happening is because this band is pulling my lower legs forward, my hamstrings have to kick in more to stabilize the knee, as opposed to the exercise being overly quad dominant, as we would call it, and then the hamstrings not doing their part to stabilize the knee. In other words, sometimes we need to move into the body's messed up direction before we try to correct and move out of it. This is a great exercise to be able to work into that eventual direction of moving the knee over to the toe before you're able to do so without pain. So while this might be contrary to some of the stuff that Ben and ATG talk about, it can certainly help you get on the road to recovery. What I'd love is for researchers to do a study where they looked at outcomes in people who have knee pain, comparing these different types of exercises rather than just looking at the muscle activity that's produced from doing the exercises in different directions. I'd also love to see some research on Ben's program and the exercises he shows when it comes to muscle activation and outcomes in people comparing different types of programs. Check out a video where I show 33 different exercises for knee pain. Click up here. If you want to keep improving, you got to keep it moving.